Yes, so my poster is on a meta-analysis and a review of comparative outcomes of mitral clip therapy versus surgical and conservative management for patients with mitral regurgitation. I'm a second-year internal medicine resident at Central Michigan University. So the title, like I said, and that's my affiliation. In terms of the background, like we all know, MR is a common and a serious valvular disease. Surgical repair has been the gold standard, but it's not ideal for all patients who have mitral regurgitation. Mitral flip is a minimally invasive alternative for high-risk patients with mitral regurgitation who may not be candidates for surgery, but are also not doing well with medical therapy alone. This study kind of compares the mitral flip with surgery and conservative treatment options. The objective of the study was to compare clinical outcomes of mitraclip with surgical repair replacement versus conservative or just medical management and assess the efficacy, safety, and durability using the data available. So a systematic review was conducted for the study using various databases, and some of the search terms which were used are mentioned in the slide. The inclusion criteria were mostly studies which were comparing either microclip with surgical or medical management, and adult patients who had moderate to severe or severe MR were included, and studies which were reporting clinical outcomes were mostly included. And Keith's reports editorials or non-comparative studies were not included. Pediatric populations were also not included in this analysis. The six studies included are mentioned here, and it included patients who were treated with mitroclip surgery or medical therapy, and outcomes were pooled using the random effects model. In terms of the outcomes assessed, the primary outcomes which were assessed included all-cause mortality, heart failure hospitalizations, and recurrent mitral regurgitation or need for reoperation. The secondary outcomes included procedural success, 30-day mortality rates, a length of hospital stay, incidence of strokes, and pacemaker implantation, excuse me. So coming to the results of the study, the 30-day mortality rates were equal, which is the short-term mortality rate for mitral replacement versus surgery. In terms of 1 year mortality, it was lower with microclip versus patients who were receiving medical therapy alone, which is kind of expected because medical therapy is not it's not an anatomical treatment. We are mostly trying to treat the pressures and the physiological problem, but the anatomical problem remains there. And heart failure hospitalizations were also reduced with patients who had a mitral flip with medical therapy versus medical therapy alone. In terms of other outcomes, patients who received the mitral clip, the residual MR was more than patients who received surgery, because obviously mitral clip is not as good as surgery, which remains the gold standard treatment for patients who have mitral regurgitation. Similarly, reoperation rates were also higher for patients who received mitral clip, so they had to do secondary procedures in these patients because some of them within the first 2 years after the procedure again developed recurrent mitral regurgitation. So the implications which we were able to reach was that surgery does offer more durable resolution. In terms of the secondary outcomes, the length of the stay was shorter for patients who received a mitral flip, which is also kind of expected because it's a less invasive procedure as compared to undergoing a surgery for valve replacement. And the secondary stroke related complications or pacemaker implantation, we didn't notice any significant difference between patients undergoing surgery versus those receiving a mitral flip, which does lead to the conclusion that it is a safe procedure and it reduces hospitalization time for these patients as well. So, coming to the discussion, the mitral flip does offer benefits like reducing heart failure admissions. It has a similar short-term survival rate as surgery, and it is a safe option for high-risk patients who may not be ideal candidates for undergoing surgical valve replacement, but their disease is severe enough for them to not be well controlled medically. And the limitations do include high rate of recurrent mitral regurgitation as well as and increased rates of re-intervention in these patients. Therefore, surgery is obviously first line for any patient who is low risk for surgery and are suitable candidates for surgery. Uh, Finally, coming to the conclusion, mitraclip is an effective procedure for high-risk patients, and it is superior to medical therapy. However, surgery should be preferred in lower-risk populations because it is better for long-term outcomes. And in terms of future research or future directions, and these clips, the companies are coming up with newer devices. So maybe in the future we will have devices which have better durability and better long-term outcomes than the devices we have right now. And we may be able to have better criteria for patient selection as well as have long-term trials comparing patients undergoing these procedures versus surgery. Thank you, everyone.